everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication in the benzodiazepine class, known as Diazepam. Its brand name is Valium. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. So Diazepam, which is a benzodiazepine derivative and anxiolytic medication, reduces neuronal depolarization, which results in a decrease in action potentials. It enhances the ability of GABA by tightly binding to A-type GABA receptors, thus opening the membrane channels and allowing the entrance of chloride. So when most people think of diazepam, they typically associate it with treating anxiety. However, there are some other situations where it can be prescribed as well. One would be an alcohol withdrawal syndrome. It can be used for its sedative effect when given as a pre-medication before surgery. It can be used to treat skeletal muscle spasms, and we also see it used in seizure disorder. And finally, it's also used in status epilepticus. Now, before somebody was to use diazepam or Valium, there are some contraindications they must clear, and some warnings and precautions they should be made aware of. In terms of contraindications, it should not be used in individuals who have acute narrow-angle glaucoma. It should be avoided in patients who have myasthenia gravis. Pediatric patients less than 6 months old cannot use diazepam. It must be avoided in situations of severe hepatic insufficiency, as well as severe respiratory insufficiency. And finally, for contraindications, the last one would be that it can't be used in patients who have sleep apnea syndrome. Now, in terms of precautions, diazepam is on the Beers criteria, which is basically a list of medications that we must use cautiously or should be avoided in the elderly population. The increased sensitivity of this population may result in increased cognitive impairment or even delirium. Falls, fractures, and motor vehicle accidents are all a concern in this population as well. It should be used very cautiously in individuals who have a history of alcohol abuse as well as drug abuse. Alcohol and other CNS depressants are not recommended to be combined with diazepam. Diazepam is being used as an adjunct therapy in convulsive disorders. If an individual was to stop the medication abruptly, this may put them at an increased risk of having a seizure. The use of diazepam is not recommended in psychiatric patients. Physicians will always be cautious when prescribing diazepam to patients who have anxiety-associated depression, as their suicidal tendencies may be increased. Psychiatric and paradoxal reactions have been reported in the elderly as well as in the younger populations, so if anything like this was to occur, the medication would have to be discontinued. Caution must be used when this medication is prescribed to individuals who have chronic respiratory insufficiency, as there will be an increased risk of respiratory depression. Now, when somebody is cleared of the contraindications and made aware of the warnings and precautions, and they start using diazepam, there are many different dosage forms in which they can receive. When treating alcohol withdrawal syndrome, typically you would start off giving the patient a dose of diazepam either intravenously or intramuscularly at a strength of 10 milligrams. In 3 to 4 hours, if the physician thinks it's necessary, they can give another 5 to 10 milligrams. When using oral diazepam to treat alcohol withdrawal syndrome, typically patients would receive 10 milligrams 3 or 4 times in the first 24 hours, and then they would receive 5 milligrams 3 or 4 times a day thereafter. When using oral diazepam to treat anxiety, patients can receive anywhere from 2 to 10 milligrams 2 to 4 times a day as needed depending on symptom severity. When diazepam is used for its sedative effect before a surgery, typically 10 milligrams would be given intramuscularly. If the patient is undergoing cardioversion, they would receive 5 or 10 milligrams intravenously 5 to 10 minutes prior to the procedure. In seizure disorder, you would see 2 to 10 milligrams taken 2 to 4 times a day. When seizures become severe and recurrent, 5 to 10 milligrams can be given intravenously every 5 to 10 minutes to a max dose of 30 milligrams. This can then be repeated in 2 to 4 hours. When treating skeletal muscle spasms with oral diazepam, 2 to 10 milligrams may be given 3 to 4 times daily. Now, like most medications, there are some adverse reactions or side effects that patients may experience while using diazepam, so I'll list some of those here for you now. Some patients do experience hypotension or low blood pressure when using diazepam. About 3% experience a rash. Diarrhea can happen in 4% of individuals who use the rectal gel. Some people experience a general feeling of muscle weakness. Others experience ataxia. Incoordination happens in about 3% of people. and others experience somnolence. About 3% of people using diazepam have an experience of euphoria. As I mentioned earlier, some patients do experience respiratory depression. One serious side effect associated with diazepam would be neutropenia. That's all we're going to talk about today with diazepam or Valium. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.